We can all recognise that the nervous system can create change. But really, what change can it make as a response or an efferent or an output? We can change muscle tone, we can change hormonal function, we can think, but in reality there's not that much more that we can do. Everything is mediated by one of those responses. And so when the nervous system detects some kind of threat, it needs to create these changes, which ultimately leads to potentially pain, changes in tension in joints, postural shifts, movement changes. P-DTR is based on the theory that those changes in response or output are a result of alterations in the input. And so if, for example, I injure my ankle, it's damaged but eventually heals. Once the healing is done, the pain often subsides. But now the local tissue can become hypersensitive to what is a normal stimulus, pressure, stretch, and things of that nature. And now normal movement can be seen as more threatening, and we must create a compensatory pattern and ultimately changes in muscle tone as a response to help. And no amount of mechanical work here locally at the ankle will change that. P-DTR looks to desensitize that sensory input so there's no longer a need for the brain to protect that area any longer, essentially putting it back to default settings. And as a byproduct, the tension, the pain, or the alterations in function will go away. And this ends the need for repetitive manual therapy, which often gains only short-term results.